Welcome to this week's session. I am Kate Tingley, Director of Marketing here at Infinix. I'm excited this week to chat with Liya Gehler, who is our Director of Product here at Infinix. And this week, we're going to chat about how technology can help with estimating patient payments and avoiding surprise bills, which, given obviously the current legislation, is top of mind for a lot of folks. So excited to have you, Liya. Welcome back.
Thank you, Kate. And I feel this is a really important topic, right? And I can just relate so I'm coming from a different country, right? So in Israel, you have a different, the health system is totally different. And when I came to the United States, it was interesting to me. Every time I'm going to the doctor and I can't get my bill, I'm like, oh, you can just kind of like signing on into this process. And you don't know what you're going to get, right? Like everywhere else, we see a price tag for everything, and it gives the consumer or gives the patient the conscious choice, and they can make a decision if they want to purchase something. But in healthcare, which is the most costly in somebody's life, we don't have that option, which I feel like it should be mandatory, and it should be something that has to be offered, especially with a heavy price tag. And especially in the urgency of care, right? Like a lot of times you're going to the urgent care, and a lot of times you're just kind of waiving it just because it's affecting your health and your life. Right. But in a lot of cases, patients should have that choice and should have that power, right? And they are a patient, but they're also a consumer of all of this healthcare system.
Right. And I think, we know providers don't like to send out those, right? I mean, they're healthcare providers because they want to help take care of people, right? And that whole billing aspect is tough. But I think for a lot of practices, we see a big impact, especially on patient satisfaction around, these surprise bills.
And it's harder for providers, right? Like a provider, they do have their own pricing, right? But it's so convoluted because there is thousands of payers out there. There's thousands of insurance companies, and some insurance companies, they do have a relationship where they are a preferred provider, right? Like they are, they know which ones have relationships. Somebody will be in network, somebody will be out of network. What region are you part of? What insurance company? And every patient have a different insurance company, maybe have multiple insurances too, right? Like some patients can have 4 insurances, and how all of it kind of works together. Like what benefits are they getting? Is it individual plan? Is it a family plan? There is so many components and moving regulations as we see now, especially with the surprise bill kind of regulations that came out in the beginning of the year. That kind of mandates it. And then on top of it, when we add in the factor of the billing system itself in healthcare, right? Because it takes time to process those payments. So it's very hard to get into the precise amount, right? Somebody can have a surgery on Monday, and they come in to a provider on Tuesday, and they already met their deductibles, but it doesn't even reflect in a lot of systems. So what do you do, right?
Right. I think it's especially challenging for those providers that aren't necessarily patient facing, right? So, provider, primary care, doctor, whatever, performs surgery or performs some sort of procedure where there's anesthesia involved. And all of a sudden the patient gets this anesthesia bill, and they're saying, wait a second, I never even saw an anesthesiologist. I don't even know who this organization is. Right. And that's we've all had that happen, right? You get that bill,
and procedure, and you need anesthesia, and you need a scan, and you need like the doctor's fee, and there is so many fees surrounding it. Right. It's such it's a fascinating area, and it's a huge problem that impacts everybody, right? Because a lot of times the insurance. So, for example, a patient will come to a provider, and then the patient won't be satisfied with the provider, right? Are they gonna come back to them again if they had like a huge bill? They're probably not gonna come back to them if they cannot pay the bill, and they're gonna source that. Hopefully, they will source the treatment somewhere else. Sometimes they won't even go and source it anywhere else, and then they're gonna be dissatisfied with the insurance company. They're like, okay, I'm paying for the insurance through my employer or through the spouse, or if they have Medicare, and a lot of times they're just not happy with that. So they're going to change that. So they can, and it eventually affects their life as well. Am I going to even seek that treatment? I know it's going to cost me so much. What should I go? Like in a lot of, especially in America, a lot of people are living from paycheck to paycheck. So they don't have that luxury. They're like, okay, should I pay rent or should I go and, treat something? And then eventually that getting escalated. And if they got preventative care, maybe they won't have that huge bill at the end and it won't affect their life. So
yeah, I think also high deductible plans are becoming more and more popular. Insurance premiums continue to go up, so for patients, they're looking at that saying, I'm paying all of this money and I'm still getting a bill, so they're frustrated. And then I think also with the high deductible plans, I think there's not a lot of education done around what that means. And a lot of times employees, when they're picking out their insurance, are like, well, wait a second, this premium's a lot less than this premium. So let me take the high deductible plan without really knowing what that means for your out-of-pocket costs.
And even between all those plans, the patient itself doesn't even know, like I have so many plans to choose from and you can't even expect what you're going to have next year, right? Like sometimes you have a condition and a lot of times you will source an insurance based on that. If you do have the option to source it, and it's not something that comes through your employer, for example, but it's hard for them to choose and pick. And I feel like knowing how transparency is key, right? It's key to trust between all those different elements, between the patient and the provider, between the patient and the insurance company, and even between, and it's interesting, even between the provider and the insurance, like which one they want to be in network and out of network with, right? There is so many implications of that. And I know like the trend before was not, right? Like I see a merge, a shift, right? And a lot of it is regulatory, but a lot of it is a behavior as a consumer and economics at scale, right? Like we see a shift. So people were not used to getting those estimations before, and I know myself just talking with providers, or like talking to hospitals, just knowing they're not comfortable to just go into the patient and saying like, hey, your treatment is XYZ, right? They just want to focus on what they're doing and not treating a patient. And they just wanted to keep it at the end of the cycle. But if that element is brought in the beginning of the cycle and the patient is provided with an estimation, right? And it could be estimation, with the current regulations, there is for certain procedures, there is a amount of deviation. Then like they can say, hey, do you agree to this? And then there is that transparency. Like it doesn't have to be like obligating legal document, but by somebody going and seeing it and seeing how it was calculated, right? And even seeing what is my amount and what is the amount of the insurance companies. I feel like that's like a comfort to know, okay, like I'm paying, for example, 20% and the insurance company paying 80%. So I see the value from me paying each month to the insurance company because they're picking up most of the lift of the bill. And just knowing like what they're going into and having a more of a breakdown of like all the procedures they need to do, because a lot of times we're just kind of blindly going, right? Like when you're in the hospital, you're like, do you have a headache? Do you want Advil? I'm like, yeah. And then I'm like, in my head, I'm like, how much that Advil cost? Like, should I get it or not? And then, yeah. But it's interesting because when I was, I'm always doing research and it's in Infinx, we're always kind of keeping up to date with the latest data. So when I was looking at it, and 34% of patients, they have medical bills, which is huge. It's 30% of all patients. And then 54% of them are defaulting on those bills. And who's eating that cost? Usually providers, right? They're just providing the treatment and then they're the ones that left with that. And then what is their resolution to that?
Right. So I think we talked about the patient satisfaction, frustration, challenges. What ways are you seeing providers address this issue and surprise bills?
Well, like I just want to kind of pinpoint more about the satisfaction, right? Like as I mentioned, there is satisfaction with the provider, right? I went to this provider, I have this huge bill. Do I want to go to them again? Am I trying to avoid it? Can I pay it? Can I not pay it? And then they're trying to resolve it. And our providers are trying to resolve that issue on the back end of trying to like provide payments or, different solutions to that. And also for the payer, like should I shop for a new insurance company? That insurance company was too high, I didn't realize, or my plan, or they need to shift plan within that specific insurance. And they're probably dissatisfied with the healthcare itself. But I just want to pinpoint that at the end of the day, the provider is trying to give treatment to the patient. And I feel like in a weird way, right, like in a round way, providing them the patient pay estimation does help increase the percentage of treatments that are given, because you have more established trust. And then to your question, what providers can do, providers can provide before, when the patient just registered in the system, when the patient just called and came to the office before the treatment, they can provide them with an estimation, right? To tell them exactly like, hey, your amount due is X, and the insurance company will pay Y. Do you wanna, can you pay, if you pay a certain percentage of it today, you can get, and I've seen it with many practices, you will get 10% discount, for example. Or they can say, well, I can't pay this amount, but do you have a payment plan? Can we break it down for 5 payments? Or they can say, like, if you will pay it within 6 months, we'll give you another discount towards the end. They can kind of play with more incentives and just knowing that they're on the right plan and they're going to pay that bill. So that's a huge part. And I know so there is basically several solutions that providers are currently doing, right? Like one of them, some payers, so some insurance companies, when you go on their portals, you do have the option of calculating some of that part, but then again, you need to take that calculation, and that calculation is, again, is it individual, is it family, is it service level? They need to get all the service level benefits, such as copay, co-insurance. They have the plan levels, annual deductible, out of pocket max, all of those things. And then they need to go manually and combine it with the fee schedules that they have, right? Is it in-network or out of network, and the fee schedules, and kind of blend all those numbers together and come with a solution. Some payers don't have that option. So they need, some practices develop their own ways of calculating it in-house, and those are the more proactive ones. There is some practices have like practice management systems that you can do it with, and some just go ahead and are being more proactive and there is a lot of solutions out there. And I know Infinx obviously is providing one of them, and that's why we're talking about it today. So you do have in Infinx, you can contract with Infinx, and then Infinx can provide you all that information. So there is integrations into their systems, into the provider system, so they don't need to go and open another login. And it's within their own realm of workflow in their system, and you can get that information right away. And just kind of like more of a shout out to the feature that we did within it. We got a lot of feedback that a lot of times those estimations, because of the long billing cycles, you don't get that. It's an example that I gave. If somebody went Monday and they have a procedure and then they're going Tuesday, it's not reflected in those patient pay estimation in those software. So Infinx's software, you can go and you can modify it. So you knew that the patient just paid $5,000 yesterday and they maxed their out-of-pocket deductible. So you can just go ahead and just input that information, and it will give you a more accurate calculation to give to the patient. And then they can print it, they can have their own logo for the practice, and they can go and, provide it to the patient can sign it, and then, and then they can talk to the patient about the payment options or how they prefer to pay. Do they want to pay the whole amount? And even kind of go deeper into it, right? Because when we're talking about it, the patient pay estimation, where is it all stemming from? It's stemming from the first contact with the patient. So the first time they come in and they give you the insurance, right? The payer need to verify, is their insurance eligible. So they need to do an eligibility check with them. If it's eligible, they can go ahead and get all those benefits. So how the patient pay estimation is calculated but by all those factors, right? Like if it's by the patient demographics, right? Like the date, their birth, what is their name, all the facility name, the facility, their codes, and it goes to even deeper, what is the procedure that is being done, and it kind of mapping all that information. And that's how it's calculating all of that and then gives the patient pay estimation. As we talked about, there's a lot of moving layers. And I feel like if it's done manually, obviously it's possible, right? That's how all the systems doing it. It's just connecting all those dots in the back end from different elements. Some of it is from the provider that they need that information, and some of it is from the insurance companies, and they're combining all of that. But if it's done manually, it can get very convoluted, and it can get very messy, and it's obviously prone to errors, but it's also a longer process that we know that providers don't have that luxury of time.
Right. How can technology, we talked a little bit about how technology can help, but can you go a little deeper into that in terms of?
Yes. So today, so it's interesting, you know, especially for Infinix, there is kind of two versions, right? You have the SaaS version that's basically taking and calculating. For us, we need to have the eligibility first. So first check if the insurance is even valid, and then map those benefits. And then after the benefits are mapped, it can speed out a result really quickly of the patient pay estimations. And it's basically the time it can be very quickly, but it's based on whatever the provider needs, how quickly they need it, right? They need it within the same day, they need it like within 4 hours, the same day, or they need it 2 days, in 2 days from whenever they're submitting that case. So all of it is done in the back end. So we're collecting all this data. It goes to a clearinghouse. So basically a clearinghouse, it's a spot that congregates hundreds and thousands of insurance companies. So instead of just going one insurance, second insurance, all that information is sent to them, and then gathering all those elements and then spitting out. There is technical combination, kind of statistical, and then it goes back to the system and it showcases in the system exactly like what are all the amounts, right? You can have in short, what is the end result? And then if they want to have expand that view, they can expand that view and see exactly how everything was calculated, so they can have that trust with that system. And a lot of times some information will be missing, right? Sometimes we don't know like the address, or sometimes the address wasn't spelled correctly. So when using that technology, it's also nice to see those errors from the beginning. And then if there is some missing information, Infinix also have on the back end, we have patient access specialists that go in and grabbing that information, and then filling it in. So the end result is accurate.
Awesome. What forms of technology are involved in patient pay estimation solutions?
Okay, so basically, as far as technology is the one kind of like connecting all those dots in one spot, right? Because there is thousands of insurance companies, because it always changes, because there are different providers and their fee schedule changes. It's basically congregating that information and spitting out the most accurate and the most relevant information, right? At the end of it, you can see how everything was calculated, and then they speed that process too. Instead of manually going and putting everything, you can just submit all that information for a certain case, for a certain patient and a procedure, and then you can get all that information in a very organized form, and you know what to look for. You can see right away, right? Like you can see what is the responsibility of the patient, what is the responsibility of the insurance companies. If you can enlarge and see how everything was calculated, like what is the deductible, what is their out of pocket, what is the co-insurance, co-payment, you can see all of those elements on that software. So basically that's where the technology kind of steps in.
Awesome. How does the technology work?
I can speak to how we do it here in Infinix. So basically, we just aggregate all that information, but it starts with eligibility. We check in if the insurance company, if the insurance itself for the patient, if it's active or not active. And after that, we're going and we extract in all the right information for, like, the service level or all the insurance elements that we need to determine the patient pay estimation. And we do it basically by sending it to clearing houses first. And then once we get that information, we send it again. And then we get the final kind of versions of it. And if there is any gaps in that information, right, like there is missing elements. So we have the patient pay, the patient pay specialists, basically the patient access specialists. They're doing it for years now, and they're in constant contact with the payers, and they know all the regulations. So they're the ones that help in filling those gaps, and everything is basically comes back to the system and displays it, if it's in the EHR or in the EMR of the provider, or if they choose to go ahead and use the platform, the Infinix patient access platform, they can go there and see all their cases and all the statuses of everything. But basically it ties in together to the eligibility and benefits. That's the first step that needs to happen. And then secondly, that's how it provides the patient pay estimation. And then there is another element, which I think it's important, right? Because some people are the self payers, the ones that go in and, they think they don't have insurance, but a lot of times they are eligible, for example, for Medicare. So I feel like if there is an extension in that sense of figuring out, or sometimes they do have another insurance, but they're just not sure, right? Like they're like, oh, is my spouse canceled that insurance or not? And then they figure out they do have that insurance. There is a software element that also Infinix provides, which is the insurance discovery element. And then it discovers between, if for patients that don't think they have insurance, it's covered 20 to 40% of them that do have insurance or they are eligible for Medicare. And then the provider can take those ones and help them kind of register and get the Medicare, and then in turn help themselves to be paid at the end of the process.
I think you brought up a good point, and you've brought up lots of good points, but what you just said, I think the days of just using your EMR practice management system to basically be kind of the be all end all piece of technology for your billing from front to back is no longer the case, right? So we've got all of these complex things. We've got prior authorizations, we've got eligibility and benefit verification, which, we all hear all the time right now about staffing shortages. I'm sure we all saw the statistic of how many millions of people left their jobs in the last, month or 2 months, which means lots of insurance changes, right? And then also the patient payment portion of it. I think it's really important that providers are making sure that they've got the right solutions on the front end of the revenue cycle for eligibility and benefits, prior auths.
They're more cost sensitive, right? Like they can't afford to lose more, right? Like inflation rate raises. They can go ahead and hire somebody who's going to be in a higher cost, and you go and train them. It's a lot of cost that they already observing just to hire somebody, and then somebody doing that job, and you can, how can I take that money and use it in a different way, right? And it's a very they're very cost sensitive right now, and everybody is too.
Right. And it just, all of that being said, it makes that, everybody kind of calls it something different, but that pre-financial clearance, patient financial clearance, kind of at the front end before care is so important, that you've gone through all of these steps. Otherwise, you're likely looking at write-offs, uncompensated care, which, like you said, providers can't afford that right now.
They need to bring it up front, right? It's always done in the back end. Like we just provide here the treatment and like good luck to you. It's like two different worlds, and we need to merge those worlds together. Because if it's in the front office, because I feel like the patient access that front, like the pre-care can solve a lot of the problems for post-care.
Right.
And they need to be more creative. And there are creative solutions out there, and they coming from the need, they're coming from the pain point that was identified, that all the pain points that costing so much money. And, okay, it costs money too, but it costs a lot of satisfaction. And the end of the day, it costs real health issues or treatments that are not done, that people needs to get done. Trust back, right? Like trust back to the patient. Like, okay, we can trust, we know exactly what we're getting, we know exactly what we're paying for, because they are a consumer at the end of the day.
Right. And I can't remember what the statistic is, but it's high enough that it's worth mentioning, that a patient's propensity to pay pre-care, if they've been given their estimation, is significantly higher than post-care, sending them a bill and then waiting for them to pay that.
And just even following up, you have the patient right there, right? Like you send it in the mail somewhere, or did they move? Like you go and hunt and you put more efforts and more money, just like retrieving that amount. When the patient is there, when you can give them more options. And I was just in a conference and we're talking with a lot of providers, and it was interesting, all the different, I know some of them will help them to identify if they can go and sign up for Medicare. They're like, we will help you here in the front office, because they know how important it is. Yeah, they're providing that additional service, but they know they're going to gain from it as well, right? It's kind of like a win-win situation. Or they have like a lot of, like I was saying, a lot of people do have those, you can go and break it down. Like, you can make 5 payments. Some of them will say like, okay, if you give me the first amount, like $300, I'll give you a 10% discount, right? And it's in the payer's mind. I'm like, okay, I'm going to get that treatment. Or sometimes like, do I need to get that treatment? Or a lot of times if, sometimes if somebody just coming into an office and they're out of network and they're doing that procedure, if they know like, okay, it's out of office, your responsibility is going to be X. And they're like, okay, actually, let me stop it here and let me go find in network that will work for me. So they can even help them redirect them by helping them kind of showcasing those costs up front.
Right. Which all of that combined does what you just said. It builds trust, right? I mean, you're completely transparent about what their cost is up front. You've then provided payment options so that you've made it as feasible and as convenient as possible. And that's how you build satisfaction. All right. Last question for you. Where do I start? If I'm a provider and yes, I need to do this, where do I start?
Okay, so first of all, you go ahead and you can see if there is somebody you trust to give you recommendations on the software. But basically, it's very easy. You just go ahead. You can search online, or one, you can get demo from Infinix, right? That it doesn't hurt. You can always see how it works, if it integrates to your system. You can come with questions that are important to you to see. Because at the end of the day, you're trying to source a solution that fits it fits your systems. It solves real problem, and it fits the cost, right? So you can come along and ask all those questions, like what is your biggest pain point? Is it you just want to make sure that you provide like a printable version? Do you care to see like how everything was calculated? Do you care to see like what payers are covered by those softwares, right? Based on the region? You care to see like testimonials from other customers? So you can go ahead and see like what's important to you. And then I will recommend like combining all those questions and then asking them and seeing how everything works. And I feel especially in Infinix, it's such a easy way. You're not bound into years of contract, right? You just having a pilot, you're happy, and you can get, in and out very quickly. So there is no risk basically to seeing how it works in your systems.
I think you brought up a really good point. If something is not going to integrate with your EMR or your PM, that's probably not the way you want to go. Obviously, having siloed systems is a headache and cumbersome. So asking that question around what integration do you provide, and what levels of integration as well.
Yeah. Or sometimes, some practices, if they have 2 people working on something, maybe they prefer to have like a third platform that they just go in, they see how all the workflow goes, they can filter based on what information they need and what they need to work on that day, and they can see it all on one system, right? Like maybe it's easier for some, and it's also something that we provide, and I know others provide, so that's also a good question to ask them.
Absolutely.
And just knowing your cost, like how much you paying for it now. Like you have 5 people working on it, 40% of the work dedicated to get those estimations, or we've seen in the past we have errors because of XYZ, you know, and asking those questions, is your software solves those issues?
Another really good point. Well, thank you, Liya. Those are all the questions I've got for you. This was really good. It was good to talk to you. But if you've got questions or would like to take a look at our solutions, don't hesitate to reach out.
Awesome. Thank you.